was fun.
Yeah, we'll look into it. So it started again. So we'll pick up right back where we left off then. Yeah, we'll just have to cut and slice it together. It's gonna be what it is. They don't like it. They don't like it. So.
When you hear the shutter, just pause.
Yep. So about every 17 minutes. So mental note. About 17 minutes, that thing's gonna restart again. So. Sorry for that. So cleaning disposal contaminated items. So we don't deal with needles a whole lot because we don't really do anything that is going to require a needle. But still, putting that stuff in the right container. There is a lot of times we're on scene with paramedics and we're doing, and it's a code and they're pumping all sorts of whatnot and we're holding a bag and we're doing all that. There's definitely plenty of times we are around needles or they hand us stuff to kind of close up and put over in that like pile of hate that they keep on the bed next to whatever. So definitely be mindful of where that stuff goes, and sometimes they usually just have a bio bag that they throw those in, and then they put it in their sharps container in the thing. So definitely worth being mindful of that. Or just some of the different medications, like you don't want to get any of it on you. Like some of that stuff could be absorbed through your skin. There might be a little bit left in there, or a little bit on there. Or Narcan. So obviously Narcan's not going to do anything to you, shouldn't do anything to you. But that goes up their nose, you know what I mean? Or you're slamming an oral airway, or you're putting in a nasal, and then for whatever reason they pull it out or whatnot. That's just covered in gross. So definitely mindful of cleaning and decontaminating your stuff. Obviously, we're probably just going to throw that annual away, but it's covered in their nose cookies, and I don't want them. So it's definitely worth being mindful of that. So what does BSI mean?
Wearing PPE, so isolating your body from those substances, so like using like gloves and masks, gloves and stuff.
Making sure you keep something between you and them.
Yep.
Yep.
Their foods.
Yep. So, what types of PPE do we usually use? I mean, we've been beating it to death. Gloves, masks, glasses, gown, I guess, if we go that far. Hey, yeah. So that kind of jazz. Anything that is going to get in between us and the victim and allows us to render medical aid without getting too much of them on us. Inevitably it ends up happening, but it's definitely worth mitigating where we can. So, I mean, we are at another technically a 30. I guess I can keep powering on for a minute, and then unless you guys are good. Okay. So we'll go for a little longer then. So, explain the process of patient assessment. So, it's the beginning of every call that you're going to go on, whether it's a responsive patient or an unresponsive patient. The responsives, they both have their own flow. Responsive patients are, well, obviously they're responsive, so their airway's good. So check. They're obviously breathing because they're responsive, they're talking to you. And even if they're not, they can be responsive to maybe stimuli. But they're still breathing, they've got circulation. If they're breathing, they've got circulation, everything's doing all right. So it's more of a kind of a holding pattern and sitting and waiting for EMS to get there. The other one, at least, is one of those situations to where we step in and we actually are able to do something. So, and for that is, obviously, if they're not breathing, unresponsive, then we're going to have to kind of step into that CPR. And it does flip it. So you're more concerned with circulation than you are the breathing, because if they don't have, if they're not responsive, then they're not doing those things. So, but without circulation, the breathing isn't going to do any good. So you got to make sure you get circulation going and then get that airway going and then work towards improving their situation and get them back to breathing. So obviously you're going to start ABCs, you're going to start airway, but if they've got pulses, then you're going to start airway. If they don't have a pulse, or obviously don't look responsive, then you're going to start with the pulses. So you're definitely immediately going to want to start chest compressions, but one thing that I think we'll talk about here in a minute, and I'll jump ahead anyway, is knowing just the different places to check your pulse. So, and some of that I've always been told, like, I think you have north of 60, I think, for a radius. So you may check the radius pulse and they have no pulses, and you're like, oh crap, they're dead. Well, they might not be dead. It's next after radius, I typically go to there. Go to the jugular to make sure. If they're not a jugular, then you're probably on your way to looking at maybe doing the immediate chest compressions. But, and sometimes you can kind of even get a vibe or a feel of how strong their pulse is in their radius. Now, if they've been kind of all crumped up or hurt, or if they're on the older side, a lot of times you can take blood pressure on one arm and it'll be different than the other one. So you may feel and get just an awful pulse in their radius, and they're fine because they've got that bilateral gel to where you don't get pulses very good on one side, and you're not going to get very good blood pressure on that side. So you definitely don't want to immediately go, oh, they don't have anything in the radius, let's start doing chest compressions. I worked with a guy when I was an EMT that immediately skipped past pulses present and thought this lady was dying, bared her chest, put AD pads on her because she thought she was having a heart attack. She thought she was having a heart attack, as in she was conscious and talking. So he kind of skipped the part where, chill out, she doesn't need the AD on her if she's conscious and talking yet. So maybe not for us, maybe when paramedics get there, if they want to do some rhythm jazz, we're not doing that. So bearing her chest in front of a bunch of people probably wasn't a real good idea. He caught some flack. So I'd definitely go with the airway. So like, especially with kids. Kids have got really small airways. They got big heads, they got big stuff, and they got small insides. So all of that stuff can get occluded. Their tongue can fall back and back their throat. So definitely being conscious of getting that airway open, head tilt, chin lift, that jazz, to make sure that you're getting, so you don't want to be doing all the work of doing chest compressions and trying to get that circulation back going, and then you're not putting any oxygen into the body. That'll work for a little while, but you need to definitely see to try to get that. If not, mitigating in some way of getting an airway.
Like our office suite.
So, obviously, if the patient appears to talk and appears breathing without difficulty, I'm going to pretty good idea that their airway's all right. And if they're unresponsive, I don't know how many overdoses we go to that they are responsive enough. Half the time they just need that airway opened up. So half the time they're not looking great and their color doesn't look great. So, but I'm going to shut the door. But if their color doesn't look great, half the time you need to just open their airway up and they immediately improve. And they're all slumped over and all that jazz. Not breathing very good. And all it takes is a simple, and you flip them over and immediately they start breathing and immediately put that pulse ox and they start doing better. But they were just too OD'd to have that good hypoxic drive. So they needed that back. I'm assuming we're still good. Sweet. So sometimes it's just simple enough to just open that airway up and you made everything better. And then you can hang out. And you give them the old sternum rub and see how responsive they want to be. So, but assessing breathing, just like I said, when you go to move them back, you're going to want to make it to where everything is in line, but sometimes you can get to where they're breathing all right and they're back going. So just look, listen, and feel. So you're going to want to see if you can hear them breathing. A lot of times you move that head back and they get that gasp because their bodies wanted to breathe that whole time, but they were too passed out from whatever they were doing that they weren't able to correct themselves. So just correcting that airway can immediately tell you that you've got.
You guys ever get that close to listen to some?
I try not to.
Never.
I don't want them whispering sweet vomit cookies into my ear hole when they decide to projectile vomit, especially after you've Narcaned them.
I think I've always been able to tell by their chest.
Right.
You know, it's like,
Right.
I don't know why
There's
you
enough. Yeah, man, and if it's so subtle that you have to be up in there, their pulses are probably weak as all get out.
Yeah.
So you're already going to be like, you dead?
Narcan.
Are you dead?
Yeah.
Yeah, what them pupils look like?
Yeah.
Yeah. So, no, I don't want to go, oh man, if you've already Narcaned them, like, I don't know how much you've messed with that. Like, they're going to, sometimes they want to just wake up and have a vomit. Sometimes they want to wake up and have a fight. I mean, champ, I've had to fight people before. So,
I've heard about the fight.
oh yeah, I run into less fights.
You don't see too many of that.
No, then usually just like, no, I wouldn't do anything. I don't know what happened.
I
Anybody
have
drugs?
emotional ones.
Yeah, those suck. Well, me and Pratt had one over the summer that he was some sweaty, ripped out guy. Like he looked like a fighter. And like we were all standing around and I was like, this dude's gonna wake up angry, it's gonna be a thing. And sweet man, super nice guy. He woke up and was like, I am so sorry. And we're like, well buddy, man, it's all right. Like,
Get better next
yeah,
time.
but like you look like I wouldn't want to take you because he was all ripped out of his mind. But yeah, so you never know. And again, that's jumping into other stuff. But breathing can be one of those things that it can be super subtle and they're still breathing fine.
Narcan plus compliments.
Yeah, doing all right. And pulse ox is nice. The problem, pulse ox can also get fooled, and that's not necessarily something they're going to talk about in here. But all it's looking is for oxygen in your blood. So it can see that oxygen that's also attached to carbon. And that will trick it. So if your CO is way high in your body, you can still show a pretty high normal reading on a pulse ox. And you're like, no, they're good. They look like a Smurf, but the pulse ox said that. So definitely looking at your surroundings and what the patient looks like they're telling you is important. So, yeah. Checking pulses. Obviously, you can go jugular. If you really want to, you can go down there in the old grundle and check for femoral pulse down
I
there.
rarely do the old femoral.
Boy, you'll see some paramedics that'll
They do
just,
it all the time.
boy, and they'll just reach in and grab themselves a handful. And Nah, typically that's not my go-to. If we need to, we'll check it out, but.
I'm a karate guy.
Same.
Stay
And you
right
know,
there.
that's pretty close to heart. Like, I
Yeah.
feel like, I know that
Close
the,
on the
yeah,
legs.
now, good luck finding a pedal. I don't know how many times I've looked for a pedal. On kids, on babies, it's handy. So I have noticed, a lot of times I can't ever get a good radial pulse on a baby. But I tend to be able to get, their necks are so short and they got like no neck anyway, so it's hard to get in there and do that sometimes.
I found the brachial on my infant.
Have you?
A couple
That
times.
will probably be a little easier than a radial for sure. And I've felt a few good pedal pulses on kiddos, but I'm not probably gonna go reach around in a kiddo's groin unless we're to that point. But just to stay away from all the other jazz. But brachial's not bad for kids, and obviously the carotid. So, but I've had more pedals than I've had radials on kiddos. So. And it's always the heavier set ones that are rough to get. So like if they're not in good shape, or they're, by good shape I mean like they're dying, radial usually goes, especially when they've lost a lot of blood pressure. But finding that brachial on a heavy set person, not real easy. I don't really want to go to the grundle. I don't really want to go try to find the femoral. So right, I mean it's, you know, pretty funky sometimes. So, but carotid still usually I've never really had a problem with it. So, yeah, so like we were talking about earlier, it takes a stronger blood flow to get pulse felt in the carotid. So than it does versus the radial. So if you don't feel it in the radial, it doesn't mean they don't have one. Just their situation may be deteriorating, but that doesn't mean they don't have one. So ABCs. Why don't we do break here, or are you guys doing all right still?
You are. It's almost 9. If that helps you.
Yeah, so we've been doing for an hour. So let's go ahead and then do a break before we start this. We'll just do a short 5-er. Can you do that?
You got about 10 minutes left before that reset.
Or do we just let's do that. Let's wait till that resets and then we'll do another short 10
6 minutes.
That'll work. All right, thank you. So ABCs of the patient. Obviously, airway, breathing, circulation. Just what we were beating to death back here. Yeah, who'd have thought? Yeah. Yeah. Long word for CPR. So. Yeah, not much we would have done.
Buckner, you ever had to do CPR?
Nope.
Not yet.
It's different. It's gross.
I've had a
never really remember
similar
learning about it
experience.
today.
It wasn't necessarily CPR, but
Yeah.
you know, had a guy OD in the barracks one time. That was weird.
Yeah, and I mean those are, especially with Narcan anymore. Like even without Narcan, you can really just kind of bag, and you can maintain the situation. Now when it comes to somebody ODing, I used to be kind of early on was more in the mindset of just like, well, just bag for them and leave them alone. But technically they're continuing to overdose when you don't administer Narcan. So that's why it is nice that the Narcan, because their situation is still deteriorating. You're just present for it while you give them oxygen. So giving them Narcan is definitely probably the way to go.
Yeah.
But you don't know what's going to wake up. But CPR in general it's a violent, rough situation. It's messy, it's gross, it's dirty, and it's nowhere near as pretty as they make it seem in the little classes that you get for doing CPR. I mean, you're breaking ribs. Obviously, all the other trauma when it comes to just like you're in somebody's home, you know, that type of deal, and they're not present, and then they've got family members sitting there watching you. It can be kind of a gross, grueling thing, and sometimes it lasts a while. I mean, I've done 5 or 6 rounds of CPR before paramedics have shown up. You want to talk about tired when there's you and the 2 old firemen you work with. You're doing most of the work. So like, yeah, it can be a thing. So it's just not, it just comes off
like
nice
9 minutes before our ambulance came last week on a CPR.
Yeah.
And then did 20 more minutes with this.
I've done, me and Aaron, even when they're there, you think you're like, oh, all right. Especially being the fireman. Like, you're gonna be doing CPR for a while.
Yeah.
And they tend to like to do like a bunch of stuff before we even wanna try to load them. So like, it can be a thing. Sometimes you're lucky enough to get the tombstone where they bring that thing out to be for you, but I've only used it twice in my career, and it's been on the south side. I never see it on the north side. Very rarely do you get to see that thing on the north side.
What, just Cox?
I think so.
Oh,
I mean, that's
Mercy,
probably
Mercy,
why,
yeah.
because we run Mercy mostly.
Yeah.
And then it's Cox, it's if they have it charged and haven't had it. You know what the tombstone is, I'm assuming. So, but yeah, no, it's gross. Or if you're following somebody like Rosie, who's leaving a dented chest for you to follow because he presses so freaking hard.
To the body.
Yeah, so no, it's a violent deal. So, and you can't stop. So like, once you've started, man, you are what is keeping that body alive. I don't wanna say you're what's keeping the rest of them alive, cause you don't know. But that's, you're between whatever them and the other. What's up?
Oh, I just moved from my dad.
Oh, nope.
Check the internet, or check out.
There's 2.5 dads in here, but not yours.
Who's the half?
Yeah.
Someone else's dad?
Yep. So,
Forgot about that.
sorry, Pete. So, obviously, there's a lot of times that we'll do CPR, and we know that it already went towards biological cell death. And you're just kind of there doing the motions until the EMS can get there and pump what drugs they want to pump and see if they can make a Frankenstein. I'm being frank, but I mean, that's really just what it seems like, so. But you're there to circulate that blood, keep that body alive, or try to. So, and this is really what sets it apart for CPR, is it gets performed a lot, but how many times does somebody see and witness that person go down? Witnessed death, whatever, doesn't happen very often. A lot of times people are coming in and they're like, oh, grandma, I don't know how long grandma's been in the chair, or any of that. Nobody's just going, at the grocery store and falling down. Occasionally, and that's why it's nice for people to know how to do CPR as a masses, but realistically, most times it's not a witnessed event. So if it's not a witnessed event, it makes it really hard to bring somebody back. I think it's really good if it is witnessed, and it's definitely, you want it as quick as possible. So yeah, the AED is nice for as quick as possible as far as defibrillation, but there's only a handful of rhythms that thing will shock. So realistically, getting CPR started as quickly as possible, and then starting defibrillation as quickly as you can, is going to give that person the best chance. But people don't just go down for fun. Something broke, so something's broken. Sometimes the broken stuff's not fixable by an AED or your CPR. They'd had a massive heart attack and they're done. Like any amount of effort you can put into that's going to fix the situation. But their best chance is to get it as fast as they can. Yeah, so we perform CPR differently than the vast majority of the masses. So, and it's not that ours is, I don't want to say better, but I kind of want to say better. Ours is just different. We do like a team-based cycle. We don't stop for breaths. We're breathing as we're going. We've got our